What are MK-4 and MK-7 vitamin K2 for bone health? Imagine a tiny but mighty nutrient that helps keep your bones strong and healthy. That's what vitamin K2 does, especially in its two main forms called MK-4 and MK-7. These are types of a group of compounds known as menaquinones, and they play a crucial role in maintaining bone strength and preventing conditions like osteoporosis. Vitamin K2 supports bone health mainly by activating a special protein called osteocalcin. This protein is essential because it helps bind calcium to the bone matrix, making bones dense and less prone to fractures. Without enough vitamin K2, osteocalcin stays inactive, meaning calcium can't be properly incorporated into bones, which can weaken them over time. Now, let's look at the differences between the two forms. MK-4 is a short-chain vitamin K2. It's quickly absorbed into the body but also leaves the bloodstream faster, so it needs to be taken more often to keep levels steady. Interestingly, our bodies can produce MK-4 from other forms of vitamin K, and in Japan, MK-4 is often used as a treatment for osteoporosis. Some studies suggest that MK-4 can help reduce fracture risk and improve bone quality. On the other hand, MK-7 is a long chain form of vitamin K2. It stays in the blood longer, which means you don't need to take it as often. MK-7 has higher bioavailability, so more of it gets into your bloodstream and stays there. Research shows that MK-7 can help slow down age-related bone loss, especially in areas like the spine and hip, which are common sites for fractures. It also promotes the activity of osteoblasts, the cells responsible for building new bone. Both MK-4 and MK-7 activate osteocalcin and support the activity of bone-building cells. They also help prevent calcium from depositing in soft tissues and arteries, which is good for overall cardiovascular health and bone health alike. Scientific studies support the idea that vitamin K2 can improve bone mineral density and reduce fracture risk. For example, some research shows that taking MK-7 over several years can help maintain bone density and strength, especially in older adults. However, results can vary depending on individual health, the dose taken, and whether other nutrients like calcium and vitamin D are also involved. In practical terms, ensuring you get enough vitamin K2 through diet or supplements can support your bones. Foods like fermented soy products, certain cheeses, and meats contain MK-4 and MK-7. For those taking supplements, MK-7 is often preferred because of its longer-lasting effects, making it easier to maintain steady blood levels. MK-4 is used in some countries as a treatment for osteoporosis but requires more frequent dosing because it clears from the body faster. It's important to remember that vitamin K2 should be part of a comprehensive approach to bone health. This includes adequate calcium and vitamin D intake, regular weight-bearing exercise, and medical guidance. People on blood-thinning medications should consult their healthcare provider before starting vitamin K2 supplements, as vitamin K influences blood clotting. In summary, MK-4 and MK-7 are vital forms of vitamin K2 that help activate proteins necessary for calcium binding and bone strength. MK-7's longer action makes it especially effective for maintaining bone health over time, while MK-4 has proven benefits in clinical settings for osteoporosis. Both are valuable tools in supporting healthy bones, but always talk to a healthcare professional to find what's best for your individual needs.